NSCLC, or non-small cell lung cancer, is the most common type of lung cancer. It can be serious, but there are treatments that can help stop it from getting worse. Most people who get NSCLC are over 65 and are either smokers or exposed to a lot of smoke. There are 4 different types of NSCLC tumors. Adenocarcinoma. Squamous cell, epidermoid, carcinoma. Large cell, undifferentiated, carcinoma. Adenosquamous carcinoma. The type of treatment your doctor recommends will depend on how far the cancer has spread. The exact cause of NSCLC is not known, but certain factors can increase the risk of developing it. These include smoking or exposure to secondhand smoke, exposure to radon, a radioactive gas found naturally in soil and rocks, exposure to asbestos, mineral and metal dust, having chronic obstructive pulmonary disease, COPD, or pulmonary fibrosis, exposure to air pollution, previous radiation treatment to the chest or breast, HIV, AIDS, family history of lung cancer. In the early stages of NSCLC, you may not notice any symptoms, or you might mistake them for another illness like pneumonia or a collapsed lung. However, if you do experience symptoms, they can include coughing that lasts or gets worse, chest pain that hurts more when you cough, laugh, or take deep breaths, hoarseness or voice changes, harsh, raspy sounds when you breathe, wheezing, weight loss and little appetite, coughing up blood or mucus, shortness of breath, feeling weak or tired, lasting lung problems like bronchitis or pneumonia. If the cancer spreads to other parts of the body, you may also experience bone pain, headache, dizziness or balance problems, numbness or weakness in an arm or leg, yellow skin or eyes. Your doctor will ask you some questions, like when you first noticed problems, how you've been feeling, if you've been coughing or wheezing, if anything makes your symptoms better or worse, your occupation, and if you smoke or have a family history of lung cancer. You'll also need a physical exam and various tests. X-rays use low doses of radiation to make images of structures inside your body. MRI shows blood flow, organs, and structures. Ultrasound creates a picture by bouncing sound waves off tissues inside you. PET scans use a radioactive compound to show where your cells are very active. CT scans make detailed pictures of the tissue and blood vessels in the lung. You may also have sputum cytology, fine needle aspiration biopsy, bronchoscopy, endobronchial ultrasound, endoscopic ultrasound, thoracoscopy, or mediastinoscopy to check for cancer cells and determine the stage of the cancer. The stages are as follows. Occult stage, cancer cells are in lung fluid or sputum, but the doctor can't find where the cancer is in your lungs. Stage 0, cancer cells are in the lining of your airways. Stage I, a small tumor is in only one lung, and the cancer hasn't spread to lymph nodes. Stage 2, a larger tumor is in one lung, or the cancer has spread to nearby lymph nodes. Stage 3, cancer in one lung has spread to farther lymph nodes or into nearby structures. Stage 4, cancer has spread to both lungs, to fluid around the lungs, or to other parts of the body, such as the brain and liver. When you find out that you have non-small cell lung cancer, NSCLC, it can be very overwhelming. You may have a lot of questions for your doctor, such as, how serious is my lung cancer? Has it spread, and what does that mean for me? What are my treatment options, and how effective are they? What are the potential side effects of the treatments? Will I need additional treatments to manage my symptoms? Will I have to stop working during my treatment? What happens if the cancer continues to spread? Have you treated other patients with this type of lung cancer? Can I participate in clinical trials, and how can I learn more about them? Is there a medical center that specializes in treating my type of cancer? It's a good idea to bring a friend or family member with you to your appointments for emotional support and to help you understand the information that the doctor provides. Additionally, you may want to consider seeking a second opinion before making decisions about your treatment plan. So how do doctors treat non-small cell lung cancer? Well, they have a two-pronged approach. First, they target the cancer itself. Second, they focus on managing your symptoms to keep you as comfortable as possible. Your doctor may suggest a combination of treatments based on the type and location of your cancer. Surgery. If the cancer is in the early stages, your doctor may recommend surgery to remove part or all of the affected lung. Radiation. This can kill remaining cancer cells after surgery, and it can also treat cancers that can't be removed surgically. Chemotherapy. This treatment can be administered in various forms and targets cancer cells throughout the body. Targeted therapy. This type of treatment works in specific ways to stop cancer cells from growing and spreading, while causing less harm to normal cells. Laser and photodynamic therapy. This technique uses a special laser light and drugs to kill cancer cells and minimize damage to healthy tissue. Clinical trials. New and innovative ways to treat cancer are being studied, so be sure to ask your doctor if a clinical trial could be a good option for you. Remember to communicate with your doctor about any pain or shortness of breath you may experience, as there are treatments available to help manage these symptoms. As you go through your treatment, it's important to pay attention to how you're feeling. Let your doctor know about any changes, both physically and emotionally. Some days, you may not feel like eating much, but it's important to keep your strength up. Try eating small meals throughout the day instead of a few large ones. If you're having trouble breathing, using oxygen from a tank may help. You can also try relaxation techniques like meditation, listening to music, or imagining yourself in a peaceful place. Gentle massage and aromatherapy could also help you feel more at ease. Talk to your doctor about managing tiredness, pain, or difficulty breathing. Dealing with a cancer diagnosis is tough, and it's normal to feel scared, angry, or sad. It might be helpful to join a support group or speak with a counselor who specializes in working with cancer patients. You can find resources online, in your community, or ask your doctor for recommendations on other professionals who can offer support, such as social workers, nurses, clergy, or other doctors. If non-small cell lung cancer is detected in its early stages, it may be possible to cure it. Even if it's not curable, treatment can still help you live longer and improve your quality of life. During your treatment, you will have the opportunity to make decisions about the options that are best for you. If you or a loved one is facing NSCLC, it's important to know that you're not alone. The Lung Cancer Alliance offers support and can help you connect with others in your area who are also dealing with this disease. Their resources and community can provide valuable support as you navigate life with NSCLC.